I'd like to call the March 18th emergency meeting of the Onslow County Board of Commissioners to order. The first order of business is a roll call, as traditionally we do in these type situations. I'd like for the commissioner, as we call your name, to answer up. Vice Chairman Paul Buchanan.
Here.
Commissioner Royce Bennett.
Here.
Commissioner Tim Foster.
Here.
Commissioner Robin Knapp.
Here.
Commissioner Mark Price.
Present.
Commissioner William Shanahan.
Here.
Madam Clerk, I declare that we have quorum. I'd like for a motion to approve the items on the agenda.
So moved. Second.
Have a motion and a second. All in favor of the motion signify by saying aye.
Aye.
Motion carries. Report and recommendations. I will turn the meeting over now to our county manager, Ms. Sharon Russell, to proceed on.
Thank you, Mr. Chairman and Mr. Vice Chairman and Commissioners. Thank you for coming this afternoon to the emergency meeting. And today we just wanted to update you on the current status and to have you consider whether or not the county should enter into a state of emergency. And I wanted to provide some new details that we have in support of that conversation. As you know, the coronavirus is a respiratory disease that has caused quite a stir in our nation. The World Health Organization has declared COVID-19, which is what we call the illness when people get coronavirus, a public health emergency of international concern. The Centers for Disease Control has warned of the high public threat posed by the disease and has prohibited and restricted travel. The United States Department of Health and Human Services has declared a public health emergency. The governor of the state of North Carolina, in consultation with the Secretary of the North Carolina Department of Health and Human Services, has declared a state of emergency based on the public health emergency posed by the coronavirus. At this time, in our county, in Onslow County, we still only have one confirmed case. And that is that same confirmed positive that we told everyone about a week ago. Now, we have received back today about 10 negative tests, but we have dozens of tests for our citizens in Onslow County that are outstanding at this point. We have no way of foreseeing into the future to know if we will get one or two more cases or if we would get dozens of new cases over the next few days. So as the situation has changed, we are trying to be careful and protect the safety and health of our citizens while not overreacting in a way that causes unnecessary disruption. I would also give you some information statewide. As of a few minutes ago, we have 59 counties and the Indian Nation, the eastern branch of the Cherokees, have declared a state of emergency. So 59 of our 100 counties. We also have 19 counties in North Carolina, including ours, that have at least one positive case of coronavirus. And of those, only 4 of them do not yet have a state of emergency. We are one of the 4. So if you declare a state of emergency, there will only be 3 counties in our state that have confirmed cases that have not declared a state of emergency. As we look at the reasons why we think that now might be a time to have this conversation, this is not about making sweeping restrictions on Onslow County citizens. This is not about immediately curfews going into place or any type of martial law or anything of that nature. That is not what we're trying to do. We would not be trying to change the enforcement of the executive order that was handed down yesterday by the governor of our state. He has specified that restaurants and bars had to close except to take out customers. This is not about extending that to anyone else. This is a measure that we wanted you to consider because it costs money to our taxpayers for us to respond and to change operations and to provide the kind of protections that our citizens need. And we have gotten conflicting guidance from FEMA and the CDC and all of the different agencies and organizations that are trying to interpret that for us on whether or not it will be necessary that we declared a local state of emergency in order for us to have access to any reimbursement funds if they become available, or for our citizens to have access to grants or funds as they become available. And we want to make sure that if that money is made available, that Onslow County and our citizens can be first in line to ask for that assistance. We are very concerned about the impact some of our citizens may be experiencing due to some of the closures of businesses. At this time, our governor has requested that the federal government approve North Carolina as being eligible for SBA, Small Business Association loans. That has not been approved yet, but that's one of the measures that we're looking at. We don't know if we're going to need to have declared a state of emergency to allow our small businesses to take advantage of that. Also, I will tell you that this morning, Amy Davis, our internal auditor, who is also our FEMA coordinator, she has already done the initial application process for FEMA for this particular event. We already have in place a time recording device, a structure, so that we're keeping track of staff hours. We have in place mechanisms to keep track of additional supplies. We are trying to make sure our first responders, our nurses, our law enforcement officers, our solid waste workers, our social workers, and others have the protective gear that they need to remain healthy and to feel confident when they're at work. So these are the types of things that we're keeping track of right now. I would also note that both Naval Hospital and Onslow Memorial have instituted some special screening procedures. They've changed some of the ways they're doing business. We've had multiple changes in some of the more recreational and group gatherings that we do as a county. If we start to see more cases, we'll have to change the way we do business on a larger scale, and we may have to restrict when people come in and out of our buildings. We may have to look at some of the food permitting that we're doing, and declaring a state of emergency just gives us the ability to do that if it becomes absolutely necessary. And we are happy to answer any questions that you may have about this as you consider it. We do recommend that you consider it at this time, and we're not going to, as we said, put forth any sweeping changes or restrictions on Onslow County citizens at this time.
One of the things I'll say that I've been here quite a long time, we've not set curfews, and we didn't have to do that. And Sheriff Hans Miller, he's been with me on 2 or 3 of these state of emergencies, and his officers and himself have used common sense, and common sense is what plays into this. So it's not us dictating anything. What it's trying to do is to protect the citizens of Onslow County, and that's what we're trying to do. I just want to share that. We didn't use any curfews, I think, in the last 2 or 3 times. Maybe 10 years ago we did one, but I don't even remember what that one was. But I know recently the 2 or 3 that we've done was no state of emergency that we did with a curfew, and there was no need for that.
Well, other agencies that we have to worry about too, the municipalities. Whatever we do, we need to coordinate with the municipalities, so it wouldn't be right for us to have a curfew in the unincorporated areas when the cities didn't have that. So it would be a mass undertaking to coordinate that with and everybody, every local government would have a different view on it. We are really, it's like getting in your car out here now and going to unknown territory and not having GPS. We just don't have a roadmap now to tell us which way to go, or even if we go a certain way, we don't know if that's the right direction or not. So we're trying to play this on a day-to-day basis. We don't have any rule books to go by. We don't have any playbooks to go by. There's nothing saying you do A or B. We just have to go through the steps as we see as the virus dictates. If you can imagine Magellan, Columbus, Lewis, and Clark, they set out on a course of unknown. The only thing about them is they knew how to get back to where they were. We don't know. We at a point now, we have to move forward. We can't go back. There's nothing we can do to go back. So we have to be proactive instead of reactive, and that's what this state of emergency is about. It's better to plan for the worst and hope for the best than it is to not plan at all or have a plan that we can't use in reimbursement for FEMA. So we want to play all the rules that we know and present that to our public and go by what we know and not what we don't know. So other than that,
Would you like for me to read the proclamation into the record so that everyone
I had a
can
question.
hear it? Okay.
How does this relate to requests that municipalities have made from the county, and is this necessary in order to facilitate that cooperation?
That's an excellent question. I was just clarifying with Norman about that. What we're having is the state is advising different agencies that if they have needs, that they should submit those through WebEOC, through emergency services. So currently, we have received 15 requests that are in WebEOC that Stacy and Norman have forwarded on to the state of North Carolina for assistance. And that's when municipalities need masks for first responders or other materials. And at this point, none of those have been fulfilled. We don't know that whether or not we've declared a state of emergency, honestly, will make an impact on that. The only experience, and to speak to what Chairman Bright just said, this is a little bit uncharted. We've never had a pandemic. We're used to hurricanes. Normally, if it's a hurricane, it's those counties that have a state of emergency that are receiving those resources as a priority because they're the ones impacted. So we are having to do the best we can under what we know. We also wish very much that we knew when the eye of the storm was going to pass over us like we do in a hurricane, but of course we don't really know that in this particular situation. I think it certainly wouldn't hurt us to have that declaration when we're having conversations with state emergency management about what our municipalities need. One other point to clarify is when this board, if in the event that it voted to do a state of emergency, of course, it applies to the unincorporated areas of the county. So for our citizens, if they're not living, if they're living in a place that is not inside the city limits of one of our townships, they're in the unincorporated areas. So it's only the unincorporated areas of the county that this applies to.
State of emergency sounds ominous, but the conditions have not changed today as from what they were yesterday. I think that's something people need to understand as well. It's just that we may need this for facilitating cooperation.
If I can ask, are there any of the emergency powers that are granted by the statute that we get because of declaring the state of emergency that we have any intent on using at this point?
Yeah, if you look at the statute, and we can have Brett speak to this as well if you'd like, but North Carolina General Statute Section 166A-19.31 gives the powers of municipalities and counties when they're under a state of emergency. And this, of course, is to apply to all different kinds of state of emergencies. There's a lot of things in here that really don't apply at all in a pandemic. Opposing a curfew and imposing a curfew rather, directing and compelling folks to evacuate. We're not going to be evacuating anything. Prescribing routes or modes of transportation and destinations in connection with an evacuation, that just doesn't apply. But some of the other things, controlling ingress and egress of an emergency area and the movement of persons in that area. I mean, certainly, if our hospitals get into issues and they need us to help with that, if we need to talk about where people need to to not go because there's large crowds that could come into play, but we're already under an executive order for that. There is also a provision that provides for the closure of different emergency areas and streets and that kind of thing. The operation of offices and business establishments, pretty much the state has already taken that one. I don't think that we've had any discussion about limiting the sale, purchase, or consumption of alcoholic beverages or about any of our gun use. So that's not something that we're looking at. It's really number 5, which is the only one that possibly would apply for us, and that's upon other activities or conditions, the control of which may be reasonably necessary to maintain order and protect lives or property during the state of emergency. Okay? So it's not quite what it would be if we had a Category 4 hurricane bearing down on us. It's different, but we still feel like it's a good precaution right now. If we were to get dozens and dozens of positive cases and we needed a little more authority, and more importantly, we just want to make sure that if the guidance changes, that we're able to get that reimbursement if it becomes available, and our citizens are able to get any assistance that might be offered by the federal or state government.
You said something, and the chairman said something, and I want the people out there that are watching via Facebook Live or whatever. Okay, this is not any attempt whatsoever to restrict anything as far as Onslow County is concerned. This is done for the benefit or the administration of our citizens, to help them, as our county manager, Ms. Russell, stated, is that we would be the first in line. There's a lot of misinformation that's being thrown out there, and I need people to understand that you know, we are dealing with the coronavirus, and we're also dealing with the decisions from the governor's office that we're mandated to follow. And as such, we have to adapt and we have to shift our schedule accordingly. And people out there that are talking back and forth about this or that, and, you know, they're talking about martial law. That's not even on the radar. No. And I want people to understand that. It's not on the radar. It's not even within, you know, the breadth of what I'm trying to say. I think this is a precautionary move. I think it's a great move that, you know, for our citizens of Onslow County that live in the unincorporated area, and like you said, you know, they hear the state of emergency. It's an ominous, you know, tone when they hear that verbiage, but it's not. And I want people to understand that we're doing this so that if there are any funds or anything, services that are available for reimbursement in the future, Onslow County would stand to get their share of the money, because that's money that is released by the state and the federal government once you declare a state of emergency. But I want to add one other thing too, and I mean this seriously, is that our county staff has worked diligently and hard on this out throughout the weekend as well. Okay, they haven't just ignored it, they haven't bypassed it, they have dug in, they have done their research, and they have worked really hard, especially our health department. And I applaud their efforts, and I applaud everyone's efforts. The fact that we got 10 test results back that are negative, that's a good indication of the measures that we're taking, and I'm proud of that statistic. And hopefully we can keep it down. So people need to keep this in a box and don't let it get bigger than the box, and we should be fine. But I applaud your efforts on this meeting that we're having, and I think it's a very good idea for Onslow County. We need to press forward. And as the chairman said, we have nowhere else to turn. We just have to keep moving forward, and that's what we're doing.
I'd like to call our health director up for some questions about the virus itself, if she could comment on that.
Okay. Ms. Hoover?
While she's coming up, Ms. Russell, waiting on this could possibly put us behind to where we could miss reimbursement opportunities if we waited and it happened to be too late.
Well, and I will tell you that earlier yesterday, we were told that we definitely needed a declaration of state of emergency. The advice that we received last night after hours was that they don't think we need to do a state of emergency, but none of this is coming directly from FEMA or the CDC. And unlike, I will tell you, we still have outstanding claims from Florence that we're still working with FEMA because some of the provisions tend to change as you go. We also have some claims outstanding from Dorian. It's a very labor-intensive process. We would like to make sure that our T's are crossed and our I's are dotted as we go into this. And then honestly, you know, the part that talks about what we can do. We would like to, if we were to get, and we have no reason to believe we will or won't, but if we were to get numerous cases at once, and we needed to change how Consolidated Human Services was bringing in people, or we needed to streamline and have only appointments into certain other departments that provide a public service, we would like to be able to do that. And it's not anything about imposing additional restrictions really on our citizens. I think the state has already taken care of a lot of those issues.
I'd just like to say this. I mean, I think this is probably a problem that exists more at the federal and state level than anything that we're doing. But it is frustrating to me that we're going to use this term state of emergency, that we're going to say in a resolution that there's an imminent threat of widespread and severe illness, loss of life and property in Onslow County, in order to essentially optimize our bureaucratic positioning in order for refunds and rebates. And it's frustrating that we have to do that and have to use that language in order to put ourselves in that spot. And I don't know that we have any other a great choice otherwise, but it is frustrating.
I tell you what, and I'm going to say this because it was brought to my attention by two particular constituents, and quite frankly, I was upset with what they said. But yeah, it may be frustrating to go through this, but I think it's a necessary step because for all the reasons that you gave, all the reasons that we have listed up here. So I kind of disagree with you on that issue completely. We declared a state of emergency during Hurricane Florence, okay? Because at that time, the hurricane was coming right down the Neuse River as a Category 4. Fortunately, it didn't. It shifted gears, but it opened us up for aid money and other things for the unincorporated areas. Even though it was an evacuation, we erred on the side of caution, and I will err on the side of caution every single time if it means saving lives and saving people and saving them the heartache of any disaster. Unfortunately, we're faced with this situation because we have the coronavirus and we don't know that much about it. We really don't. I mean, it's part of one of 4 or 5 branches of the coronavirus. It's COVID-19. We know nothing about it. We don't know how it travels for the most part. All we're doing is guessing. Even virologists are trying to still determine that. So I think this is a necessary step, and well taken points that you made about doing this now to get out in front of it, okay? If we don't have to use it, and we don't have any issues with it, then so be it. There is no harm done. But I'd rather be safe than sorry for our citizens within the county, period, so that we can have the funds available, we can have the services available. Maybe the process is kind of tedious, and we're here now, and so I think it's a good call as far as I'm concerned.
Ms. Hoover, go ahead. I'm
I
sorry.
was just going to say, and I apologize, Ms. Hoover, because we've got her up here and we're still talking, but I think this conversation is important to have because the difference between a hurricane coming in and what we're facing now, the hurricane is almost a tangible type event that takes place, and something of this nature is not quite the same because we haven't been here before. So I appreciate the conversation we're having in the discussion because I think this discussion is more important to the people that are listening and hearing this, that they are very well informed in what is taking place. If we just come out and declare a state of emergency, we already got enough panic and concern taking place just from turning on the television and the doomsdayers out there saying what they're saying. So I think this conversation is necessary. I think we need to have it. I think we need to continue that discussion so the folks that are listening to realize the reasons we're doing it or the reasons we're considering it and what it's not doing and what it is doing. You read the news and you do see down in some of the other places further down south that they're banning the sales of weapons and ammunitions and things like that. There are people out there that are asking that question. And I think this conversation needs to be had that we sit here today and we say, that's not what we're doing. And I think it's important for them to hear that. And at the same time, we need to know that if we feel like or we see and the constituents see and call us and tell us that, man, you're overreaching out there, the sheriff's office is overreaching, this department's overreaching, then we want you to know that in the last section of this, we can come right back together and we can rescind this and stop all of it if we get to something of that nature. I don't think we're going to get to anything of that nature. You pointed it out very well, Ms. Russell, with it's item 5. which is to make sure we're doing things safely and taking care of things, and we're not going in to do anything that's going to encumber the rights of our citizens. But we want to make sure that we are informing them today that their rights are at the forefront of this, but their safety is right there running
Right.
neck and neck with it. And we want to make sure that we cover those bases. And at any point, Chairman, if we see something is going too far, we need to get back in this chambers and stop the motion of something along those nature. I don't think that's going to happen with our sheriff and our law enforcement, but the people need to know that we're here for them, for their safety, and to make sure we're here for their rights as well.
Well, I wanted to call Ms. Hoover up. Did you want to?
I'd like to say something real quick if
Go
I
ahead.
could. The key to this thing is being proactive, and that's what we're doing. The staff has done that, and the safety of our citizens. Nutshell, proactive and the safety of our citizens. That's what we got to do.
Ms. Hoover, what I wanted to ask you was, you're probably closer to this than a lot of people because of being our health director, but that was really good news about the 10 tests that came back negative. How many tests do we have that's still outstanding, or don't you actually know that yet?
We do have a number that is out there. We are reluctant to give you a number because it's constantly changing. We will
Okay.
hear and have conversation with our partners at Base and at Onslow and with our community providers. And they are constantly calling us, seeking guidance for whether patients need to be tested. And so they will indicate to us verbally that they will be submitting paperwork for another person under investigation. And that is the terminology that we're using for someone who is being tested.
Okay, my next question would be, what of the people that come back negative, that was tested, that come back negative for the coronavirus, what were the symptoms on the ones that came back negative compared to the ones that we haven't got back yet?
So all of the symptoms for individuals who were tested are similar in nature, that they would have fever, they have respiratory symptoms, cough, and that is very common right now between allergy season and between the flu season that is still ongoing. Those are symptoms that we're seeing a lot of, but that's the criteria for being tested, is that you have a fever, you have symptoms.
And the other question was the one that we do have that was positive on base, how long will it be before that person or individual is cleared to get back into the regular walks of life?
So at this moment, and that is something that is updated continually too, so at this moment, the guidance for clearing someone who is isolated has been confirmed as a case, is that they must be symptom-free, and there is no longer a requirement that they have clearance laboratory testing. There's two options. There's one avenue that you can pursue where they do have labs that get cleared after a certain number of days, or they can be symptom-free for a certain number of days, and it is stated as whichever is longer. So there is some guidance that is there for that. But for the individual that is currently our presumptive positive case is being monitored by public health on base, and they are following that
Is
individual.
that person getting better, or we don't know, or?
That they're being followed by public health on base, and so we don't know all of the details of that. But if there were any concerns about deterioration of their condition or not improving as expected, I trust that they would have told us that. As far as we know, they are still at home, which is a good sign, and there has been no need for an increased level of care.
Well, that's really encouraging, because the tests that we did get back, the 10 that we did get back was negative, and that was the reason for asking the question about why we tested the other ones that hadn't got back yet and the symptoms. It gives that's some of the questions I get as an official is, how soon are we getting the test back? Why is it taking longer to get the test back? And has the ones that got tested and come back negative, are those symptoms the same as the ones that we haven't got back yet? So that's really encouraging, and it's good that we're putting that information out there through this meeting, for one thing, to let people not get in a situation where they're afraid to even leave their home to go grocery shopping.
Absolutely. The last thing that we need is for everyone to be fearful. We need people to be practical and prudent in a lot of their behaviors, but the guidance that we have put out really is practical at this point. The good hygiene messages and social distancing are all things that are simple for folks to accomplish, and we just need them to adhere to that guidance.
I have a question for you, though. Going with the chairman, though, I know you use the parameters of the symptoms, people that are symptomatic of this particular virus, which can mimic other types of conditions. Are there other parameters that we're using? Because I'm looking at it from Onslow County being a very transient county, with the military being here, with people that are coming in and out of town. I mean, are there any other parameters that we're using to screen certain people for testing, i.e., like, where have you been overseas? Where have you been, et cetera?
Absolutely. So some of the Epi Linked Factors that are different from the clinical factors, the clinical factors would be those signs and symptoms that we see of fever, respiratory symptoms. You have to have some type of epidemiological risk factors too. That might be travel to a high-risk area where we know that there is ongoing transmission, and that list of countries is long. It could be contact with a confirmed case. We know that that has been of a concern here since the case that we do have had contact with a confirmed case. So those are factors that are being assessed in these individuals when they are screened for their need for testing.
What makes this so difficult is it's already in allergy and flu season, and a lot of people that may have some symptoms, they feel like that they may be subjected to somebody that, especially if they've been in contact with somebody out of state or something like that. So I think that's where the big problem is. Do you think that the warmer weather has anything to do with it coming, or?
We hope that the warmer weather will be a benefit to us. We know that a lot of other respiratory viruses that we see are less active during those warm months. A lot of viruses are less stable at warm temperatures and less infectious, less easy to spread around. So we hope that there will be some decrease with the warmer weather, but it's too soon for us to know. We haven't seen this novel coronavirus in warm weather so far, and so some of that we are going to learn it as we live it.
I know the virus is spread through droplets from the membranes. I get that, the membranes, sneezing and such. That's why we're doing the social distancing. Has there been any tests whether or not this virus is airborne? And how long is it airborne for?
So when we think about respiratory droplets, whenever we look at it on a microscopic sense, these droplets are large, heavy droplets that would have a shorter distance that they could spread. That's the reason for the 6 feet perimeter that we think about. When we think about airborne diseases like tuberculosis and measles, these are much smaller microscopic infectious particles that can stay suspended in the air for a period of time. So when we think about coronavirus, we're thinking larger, still microscopic droplets that will settle out of the air quickly with only a spread of 6 feet. Other airborne infections may stay suspended in the air. You could leave the area, come back into that environment, and it's still suspended in the air, and the risk there is inhalation. We don't believe that that's the primary route of spread for coronavirus. However, in some settings where you would be doing aerosol generating procedures, such as in inpatient healthcare settings, in hospitals, whenever they are performing bronchoscopy on patients, doing certain breathing treatments on patients. Those are settings that are higher risk, and those are the settings where we would advise a higher level of PPE. So that is the difference in the requirements or the advice for an N95 fit-tested respirator versus a surgical or a face mask. Does that make sense? I hope.
It does.
Okay.
It clarifies why we're using sanitizers and stuff like that, because like you said, it falls out of the air, it's on the surface and stuff like that. So that explains it a lot.
And there is some risk of indirect transmission. So if a surface was contaminated, that it could be picked up from that surface by our hands, introduced into our body by touch or by what we have picked up on our hands, thus the guidance for frequent cleaning and disinfection of those surfaces.
Anybody have any other questions for
Thank
Ms.
you.
Hoover?
I appreciate it, Mr. I think you've just probably answered 200 people's questions out there by clarifying that with Commissioner Knapp's question, because I think that's something that
a big
people are
help.
walking around going, what? And knowing the what is half the battle.
That's the purpose of having you come up and letting people, information is power, and that's what we want to do, get right information out so people can address it the best way they can. I'd like to thank you.
Thank you very much.
Paul?
Mr. Chair, this just came in from the city of Jacksonville. A state of emergency has been declared. This does not set a curfew, nor does it close any businesses. Please see official sources for more information. City of Jacksonville just declared a state of emergency.
Thing.
Just came in.
Okay, I'd like to turn it back over to our county manager, Ms. Sharon Russell.
Thank you. I'm going to read the proclamation of the state of emergency by the chairman of the Onslow County Board of Commissioners. And a lot of this language, of course, tracks statute. Section 1, I have determined that the COVID-19 pandemic poses an imminent threat of or existing conditions have caused or will cause widespread or severe illness or loss of life or property, and a state of emergency exists in Onslow County, North Carolina on this, the 18th day of March 2020. Section 2, pursuant to Article 1A of Chapter 166A of the North Carolina General Statutes, I therefore proclaim the existence of a state of emergency and threatened disaster in Onslow County, North Carolina. Section 3, I hereby order all Onslow County officials and agencies to cooperate in the implementation of the provision of this proclamation, recommendations from public health, and the provisions of the Onslow County Emergency Operations Plan. Section 4, I hereby delegate to Sharon S. Russell, County Manager, or her designee, the authority granted by the Onslow County Emergency Operations Plan for the purpose of implementing the said Emergency Operations Plan and to take such further action as may be necessary to promote and secure the safety, health, and protection of the populace of Onslow County, North Carolina. Section 5, further, Norman Bryson, Emergency Services Director, and Chrissy Richmond Hoover, Public Health Director, are deemed Chief Coordinating Officers for Onslow County for the duration of this proclamation. Section 6, I further declare that the following restrictions and suspensions are in effect during the state of emergency. Number 1, employees of the County of Onslow and the Sheriff's Office located in the County of Onslow are hereby expressly authorized to restrict citizen movement, implement control measures, or to go upon private property for the purpose of carrying out public health orders necessary and appropriate to ensure that COVID-19 remains controlled and that residents and visitors in Onslow County remain safe and secure for the purpose of maintaining the public peace and to ensure sanitary, healthful conditions. Number 2, the regulations promulgated by the North Carolina Department of Labor, OSH Division, governing worker safety are suspended during the state of emergency as to emergency management workers, including law enforcement, fire, rescue, and emergency medical services of the County of Onslow, and volunteer fire and rescue departments of the County of Onslow. Section 6, I further direct Sharon S. Russell, County Manager, or her designee, to seek assistance from all agencies of the United States government as may be needed to meet the emergency needs and seek reimbursement for costs incurred by the county and state in responding to the emergency. Section 8, I hereby order this proclamation to be distributed to the news media and other organizations calculated to bring its contents to the attention of the general public unless the circumstances of the state of emergency prevent or impede, to be promptly filed with the clerk to the Board of Commissioners in the County of Onslow and hereby posted in the Onslow County Courthouse. Section 9, this proclamation shall become effective immediately and shall remain in effect until rescinded. In witness whereof, I have set my hand and signed this proclamation on this, the 18th day of March in the year of our Lord 2020, by the Onslow County Board of Commissioners, Chairman Jack Bright. At this time, we would respectfully request that the Board of Commissioners consider the proclamation of the state of emergency for the unincorporated areas of Onslow County, and if passed, if put in place, authorize the chairman to sign on behalf of the county.
Motion to approve.
Second.
A motion and a second. Any further discussion?
I think this situation's changing so rapidly, it's like hourly. It would just be irresponsible for us not to go ahead and take care of this today and get it out of the way in case it needs to, situation needs it.
It's important to know this is not announcing any closures of anything related to the government. I think some folks have been concerned with that. It's going to be business. We're not going to put any business in jeopardy or hurt their way of life. And I just want to make sure that they understand that none of that's going to take place. And everybody's going to proceed with caution with the results or what the state of emergency has on organizations.
And I just want to give a shout out again, once again, to our health department and you, Sharon. You guys have been walking very circumspectly on this. And I love what you guys do in the updates, and thanks for staying on top of it. And just keep up doing the good work, and we'll get through this.
Any further? We have a motion and a second. All in favor of the motion signify by saying aye.
Aye.
All opposed? Motion carries unanimously. Thank you for your presentation. I will now entertain a motion to adjourn.
So moved.
All in favor? Aye. We are adjourned. Thank you. Thank you for folks for being here.
Thank you.